Hospitals are just not ordinary buildings. They are the venues or areas where healing takes place, and hence they require creation of spaces that aids and abets the physical, mental, psychological, and emotional recuperation of a patient. And hence, all care has to be taken while designing of a hospital or while making of a hospital. There are numerous subjects which needs to be considered in the Vastu science of making a hospital, right from choosing or selecting the land. If you choose a land which is triangular or which is cut or which is in the shape of a cross or which is next to a graveyard or a well or a water body in the south, that hospital will never do well. There will be numerous complaints from the patients, and hence the first step starts from the selection of the land where the hospital has to be made. There are numerous other things, the selection of the land, the selection of the soil, that will become a very vast subject. But in today's video, I'm going to specifically talk about the clear cut directions of the various departments within the hospital, because naturally somebody who has already made a hospital, he cannot uproot the hospital from its roots. He cannot break the hospital, and I do not advocate that. But yes, at least if he takes a cognizant of this fact that the departments which rule a particular direction, if they are aligned and synchronized with what I'm going to share, definitely the patients also they recuperate within a passage of time, and the doctors also earn a lot of praise, and the hospital also earns a lot of praise and a good EBITDA at the end of the day. So I have made some notes on my research of past few years and the hospital Vastu which I have done, and I have found certain uh, pointers of this Vastu sciences as mentioned in the classical texts. So I would request you to kindly listen to this video till the end, and carry as much information if you're a doctor or if you are a aspiring entrepreneur who are going to or about to open a hospital. So the first and the foremost uh, interior planning or the direction of the department which I'm going to talk about is the casualty and the minor operation theater should always be in the northeast direction, because these are of immediate necessities, and actually this is also called as emergency room or emergency hall in many hospitals. So please note that this casualty, minor operation theater, emergency rooms should be in the northeast part of the compound, northeast part of the campus. The chairman's cabin, that is the chairman's office or the owner of the hospital, has to be mandatorily in southwest. It can also have a clinical laboratory and ultrasound. All these things can be kept in southwest, because the ultrasound machine, as we all know, is a heavy machine, and keeping a heavy stuff in the southwest is always beneficial, and hence this ultrasound machine etc can be kept in the southwest direction. Of course, the interior planning of the southwest has to be done again with Vastu. You should use all the earth colors, golden colors, yellow colors in the southwest, because southwest is the earth element, and you cannot use any other color except for wooden, earth, golden or yellow, and this is highly prescribed in this part of the hospital. All your fire elements like canteen, kitchen, transformer, generator, power backup, electric meter, or even computer rooms can be in the southeast part of the campus. It has to be mandatorily in the southeast, because this is the Agni cone. The consultation OPD rooms where you consult your disease with the concerned doctor should be in the north or east directions, and doctors should face sitting with their face towards aligned towards northern or the eastern direction, and then it is bound to have a fruitful and conclusive discussion and diagnosis. So the doctors and the OPD consultation rooms should be in the north or the east part of the hospital. Elevators, staircases, laundry, toilets, washrooms, etc. has to be in the northwest direction of the hospital. A part of northwest is also called as the direction of disposal, and hence having the laundry, the washrooms, the toilets in this area, even the elevators and staircases in this area is always found to be lucky. Um, Reception and cash counter can be in the north or the eastern part of the hospital, as it is considered to be auspicious. Always remember that the southern and the western part you should keep a little closed, except for the few points and the few exceptions which I'm going to talk about it, and rest of it should be actually closed. The southern and the western part of the hospital, and the northern and the eastern part of the hospital should be open as much as possible. The area between the north and the northeast in Vastu sciences, which we normally refer to as north of northeast, which is approximately 22.5 degrees from the northern direction. This is the best area to administer or to supervise or to make or to produce a medicine or keep that part as a medicine room or to store the medicines, because north of northeast is considered to be the direction of immunity. And this also, you will also see that not only in the hospitals, but even if in your residences you are a diabetic patient, you are a blood pressure patient or thyroid patient, and if you keep all your medicines in a box, accumulated in one box, and if it is kept in the north of northeast direction, which is the direction of immunity, you will find that eventually with passage of time the medicines will disappear, because north of northeast is the direction of immunity. The early morning sun rays make the medicines more potent, and that is the reason why we ask the north of northeast part of the hospital to be kept as the medical room or the store room, or you can administer process the medicines in this part of the hospital, and they also help in faster healing. Intensive care units can be located in the northwest sectors. The ICU units can be kept in the northwest sectors, and the post operative care rooms, the wards, the rooms post operative care when the patient is shifted after the operation is successful, or when he is to be taken after the ICU recovery, that should be in the northeast part of the hospital. So the ICU has to be in the northwest, but the post operative, the post surgery room or the ward can be in the northeast sector. The scrubbing and the washing areas, the linen cupboards, the central sterile supplies, even the housekeeping liquids. There is a very specific housekeeping liquid which is used to kill the or disinfect the floor, or kill the germs in hospitals. They have huge cans of those liquids that can always or should always be kept in southeast. Reason being, all these chemicals are also representation of Venus, and Venus direction is in Vastu sciences southeast. So all your housekeeping stuff, your linen cupboard, your sterile liquids, your other forms of liquids, your housekeeping liquid, all this should be mandatorily kept in the southeast part of the hospital. The maternity ward can be specifically between the northeast and the eastern part of the hospital. So northeast and east, there is a, so you have east 90 degrees and then you have northeast. So the space which lies between the east and the northeast is specifically kept reserved for maternity wards. The minor and major operation theaters and surgical ward should be in the northeast sector because it is considered to be very auspicious, and again the doctor should face the north or the eastern part, as I have described in my earlier part of the video. The X-ray machine, CT scan, physiotherapy and similar machines should always be kept in the southeast corner, because these machines also create heat, and the heat element should always be administered in the southeast part. Cardiology department, that is the heart department or the TB centers, can be kept in the eastern part, and the mental health care should be kept towards the west. So your neurology, something to do with brain, treatment of brain, counselors, psychologists, psychiatrists, they should be a part of the western part of the hospital. But the cardiology department in the TB center has to be mandatorily towards the eastern part of the hospital. Mortuary or post-mortem, or where the dead body is kept for a few hours, few days, should always be kept in the southern part of the hospital, because the southern part or the south is the direction of Yama, the god of death, and hence The dead body, the mortuary or the postmortem, the body after the postmortem or the room of the postmortem should always be located in the southern part of the hospital. A temple or a meditation center should be made in the northeast sector of the hospital, and one should note while constructing that the shadow of the temple should never fall on the hospital. So it should be a small temple, very small temple. You can have a Ganesha idol, you can have the Shiva idol there, and this gives a lot of solace, peace of mind, support to the visitors, to the guests, or to the support staff of the patient, or the support family members of the patient. So, a temple in the northeast part, a Shiva temple in the northeast part, with no dustbins around, with no chappals around, with no footwear around, should be very neatly and